Pt.7. I guess you could say I'm on a roll this morning. I guess I left off the last video. I'll be freezing cold. I'm super little. Talking about how in college the things that I learned ultimately led to me able to preserve myself long enough to get to the Gerson therapy. I had got learned a lot and about how the body needs vital things to survive. And so I was trying all these different treatments with food, actually, with diet change and lifestyle change as much as I could to fix things. And I had got the atypical migraine diagnosis from my doctor. And actually, for the first time, it was the diagnosis that I didn't pay any attention to, because it didn't, to me, I was like, it's not a migraine, whatever he's saying, this doesn't make sense. I'm not having a stomach ache, I'm having digestion issues. And I didn't put it together. And so I had continued to suffer. And at this point, my kids had watched me suffer for so long, they decided to start trying to help me. And so when I would have my attacks that were no longer lasting 4 to 6 to 8 to 16 hours, they're now lasting 20 hours and 40 hours. And I'm down for 40 hours and my kids can't ask me for help. And I can't be of help to anyone or even to myself. And so they started helping me. The short attacks, they kind of would try to ignore and go about their way and try to pretend it wasn't happening for so long, until it got to a point where I needed help. And I needed help because the longer I didn't get help, the longer the attacks lasted. And so it was a point that they were the only people that were here. And so there was no one else coming. And so they started to help me out a lot. And so in 2013, things just continually declined. In 2014, at the beginning of the year, I no longer was able to control it in any kind of way. It was every day I was sick. I was sick every day. Everything I ate, everything I put in me, it made me sick to my stomach. And I was still using the weed and the Vicodin to help me get through work, through the day. And that was the way that I would survive through 2014. And that year, Thanksgiving, I remember not eating anything because I was so scared to eat. And I didn't want to not enjoy myself or the family because I was going to eat. So I just didn't eat. But I hung out with the family and I had a good time. But I remember a couple of days after the attack came, and it was horrible. It was hard. The purging part is really hard because I have IBS, and IBS makes it so that it's difficult to get anything out when you go to the restroom. And then I have this condition where I have a system that's overfilled with toxins and needs to purge, except that when the purge time comes, I don't have the ability to relieve myself. And so I'm stuck dealing with the pain and not being able to relieve myself. And it got really hard. It got really bad that month. It was probably the worst month I had. And the attack, it was the first time my attack lasted more than 40 hours. The attacks would start lasting 2 days. But after it was over, it was over. This time in November 2014, it was the first time that the attack lasted 4 days. I believe it was 4 days. And after that, every month, it lasted 4 days, and then it lasted 6 days, and then it lasted 8 days. And now I'm up to, I was up to, I don't know where I'm at now, because everything's going to probably change with the Gerson therapy treatment, because I've been feeling better and the attacks have been lessening and been less frequent. But I had got up into a point where I was having severe attacks on a daily basis, and the marijuana wasn't even able to stop the attacks it would just suppress the symptoms. It would just keep me calm and relax me as I had to just go through it. But I had got up to 14 days all the way through 2015 up into 2016. I was going through 14 days a month of purging cycle, and then I had 1 week of dormance. Well, I had 1 week of recovery, because once you go through the purging cycle, it takes everything out of you. And then you have a week where you start to feel a little better, and you can slowly take in food again and get up and move around normally again, slowly. And then after that, you have 1 week, which is the dormant week. And during that week, I can almost eat anything, get up, move around. It's like almost as if I'm disease free. The frequency comes, it does come. There was points when that time where I was symptom free, but then it got to a point where during that week, I still would have slight symptoms. And so I still had to be paying attention and not doing too much, because after that week was over, if I got too excited and forgot about being sick and went and ate everything that I had been wishing I could eat while I was sick for 14 days, I was stuck with all that toxins in my body at the end of that week, and purge was coming. And the purge was coming, and I was full of toxic, and I just eaten, and then the cycle would start again, and there would be 14 days of downtime and a week of recovery and a week of me feeding my body toxins just to purge all over again. And I mean, that persisted for a long time before I realized that was another cycle within the cycle. And by this point, I had given up on the diet. Honestly, I can honestly say I had given up on thinking that diet would help me. And I was looking for an answer again from the doctors, some medicine that would help, or by now some type of structural abnormality to have formed that can answer my question of what is going on. But still, 2015, I went to go to UCSF and to the specialist and the gastroenterologist there, and just to have the same thing to be told to me. We don't see anything wrong. And for me to finally stand up for myself and say, yeah, it's not something that you have to see. It's something that you have to find. And for my doctor to say, you're right, because all of this weight loss has to be explained some way. Something's going wrong. You're definitely dealing with something. And it's not structural. And that's when we both decided that I needed to see a further specialist, an endocrinologist, because the problem that I was having was a lot deeper than the structural function of my gut function. It was something deeper than that, causing the gut to not work properly or effectively or efficiently as it should. And so that left me to kind of where up to today. In 2014, I started to lose weight. I was 190 something pounds. I wish I had a picture here to show you like how I actually looked before all of this hit the fan as bad as it did. Before my body had filled up with so much toxins that it could no longer continue on. And there was no nutrition. I was getting no nutrition. And so my body just basically started to eat away at itself. It ate all of the fat away. And then I had gotten to a point this last few months, actually Christmas 2015 is when I would say that the decline happened all the way down to the point where I was at, and like I said in my first video, 2 breaths away from death. My birthday was in December 7th. Didn't do any celebrating this year. Actually, the day of my birthday, I kind of just rode around with my friend, hung out with her, and had an ice cream and a sip of a drink. Just to say happy birthday to myself, an ice cream, cake, and a sip of a drink, which I knew was risky. But it was my birthday, and my attack had just came on the 1st, and I should be good. That's what I was thinking. It was my recovery week. But no, ended up in the hospital from that night. Had a really, really, really heart attack after that. It lasted for 48 hours, and I had to go to the hospital, and they gave me something to put me down, and then I woke up, and I felt I had enough strength to get up and leave. So I got up and left, because when I do go to the hospital, they don't do anything. All they do is run my baseline vitals and baseline labs and say, oh, we don't see anything wrong with your lab work, and there's nothing on your x-ray. Well, they don't even do an x-ray, but if there was, when they do one every rare blue moon, red moon, whatever you want to call it, yeah, they never see anything. So you know, and it was very, very discouraging for people to tell me that I wasn't experiencing what I was experiencing, because they couldn't find an answer or a reason to explain it. And so one day I went to the hospital to my doctor's appointment in 2015 with the kids. And I remember telling my doctor, this is a new doctor I had never seen before. You know, God works in really, really mysterious ways, because my doctor was out this day, and this doctor had came and taken his place. And for the first time, it was crazy, because it was the first time I ever decided to take my kids to an appointment with me, because they were here to witness what I was going through. They could actually subjectively and objectively explain what they saw and felt that I was going through to the doctor, and not the doctor hearing me say it and thinking I'm just, you know, making up these complaints. But you can see when I have attacks, you can see what I go through. So I brought them just so that they can explain and tell how it's affecting their lives too. But as I'm explaining to the doctor what I'm going through, by the end of the conversation, he diagnoses me with cyclical vomiting syndrome. And I remember thinking, oh God, here we go again. It was difficult time. So I remember getting the diagnosis of CVS, and I remember thinking, wow, here we go again. Another diagnosis, cyclical vomiting syndrome. Really? What is that? And I remember him explaining to me that it was a rare disease, and not a lot of doctors had heard of it, but he had heard of it because he had encountered a case by some rare instance, you know, some rare situation. He had encountered a case in his previous studies, and he had known about it. And when I was explaining to him the things that I was dealing with and how hard I was going through it, and he just simply said, oh, this is what you have with the IBS. And I remember thinking, you didn't even let me finish. You didn't even let my kids talk or anything. And so, but it was the first time I really didn't even argue with the doctors, because I had given up on arguing with the doctors and so forth. And so what I decided to do was just go look up this diagnosis. And so I couldn't wait to get to the car with the kids and hurry up and go put in this new diagnosis and see what was it going to say. And I remember for the first time ever reading it and thinking like, oh my God, I finally got an answer. This is crazy. What is this? What is this? What is this? And that was probably the worst part, was getting the answer. It's because then the doctors really didn't know what to do from there. They didn't know what the disease was. They gave me a medication called amitriptyline, which they prescribe for people with migraines. But it took away the migraines I was having, but it didn't help with the sickness that I was dealing with, the flu-like symptoms and the nausea and the vomiting on a regular, consistent basis. And so they were just basically telling me that I wasn't trying to make it work. I was trying to do everything I could to work against it, which to me was like, what? How crazy do people think that you gotta be? How crazy do people think that I am, that I would just purposely want to destroy myself? So I just decided, okay, I'm going to learn everything that I can learn about cyclical vomiting syndrome, and I'm going to research it, and I'm going to find it out. And I just basically did the same things that I did with IBS. And that was my next journey, was to discover what I was going through with cyclical vomiting syndrome, what the disease was, how it came about, and what I could do to treat myself, and was there treatment at all. Part 6 is here. Part 7, I'll come back and I'll talk to you about my journey with learning about CVS. Thanks for watching. Stay tuned. Part 8.